All right, welcome to another one of our peer-to-peer video series where people who've taken the clinicians who've taken the foundations and manual therapy seminars, they come back and they share their experience, good, bad, difficult, easy, how they found it to work. And Elpida, thanks so much for joining me today. Do you want to introduce yourself?
Yes, thank you for inviting me, Walt. So I'm a speech therapist. I've been trained in the UK, and I very quickly realized that all I wanted to do was work with voice. So for the past going on to 26 years, I've been working with voice. I also hold a degree in a psychology degree as a first degree. So speech therapy came later as a postgraduate specialization. And I've been trained in the the voicecraft approach. It's been used by Joe Estill, but she also trained someone called Alison Bagnall. Not sure if you know the name. So it's a very mechanistic approach to voice rehabilitation. So what it does is it looks at the voice in terms of the parts of the anatomy and the physiology, and then putting that together and working on how to use the physiology at an optimal level. So along the road, of course, I realized what everyone has now realized, that you can't work with physiology alone. You need to work with a whole person. Mm-hmm. And you need to work with everything about the whole person, the way the person thinks and the way the person feels, and then put that all together with the physiology and get the voice working better. So I work primarily with voice disorders and also a little bit of much less of swallowing disorders in the context of a voice disorder. So if it's something that's only swallowing, I'll refer on to other colleagues. So that's what I do, principally with adult populations, a little bit with pediatrics, but more on the adult side. And I also work a lot with the adults. I work a lot with vocal fold paralysis. So unilateral and also bilateral vocal fold paralysis. And things get tricky there. So it's usually people come to me after total thyroidectomy. And it's a tricky field in Greece, and it has only sort of evolved in a positive respect in the past maybe 5 or 10 years. So we didn't used to get a lot of referrals, and now we get a lot of referrals. So it was tricky because these patients have varying needs, and a lot of the needs are related to scarring, of course. And so I had been trained a lot by Jacob Lieberman, and I had that point of view in my head. Mm-hmm. And it works for some people, but there's a lot of cases where that doesn't work. And so this is where I felt that I needed more input. So that's a little bit of my background. Do you want to help me along with questions, and then maybe I can add to my experience?
Yeah. You're doing fine. That the concept of the mechanistic, working with the anatomy, working with the physiology. I think, although no one has ever said, no, I don't work with the whole person. But there are approaches that are more mechanistic, more biomechanical. And then there's others that are more free-flowing, esoteric, or come from different perspectives. And I too have studied with Jacob Lieberman in terms of the laryngeal manipulation. And I know we just got together again in May in Athens, and I kind of presented that. I used to say I don't use any of Jacob's techniques, but I found a lot of educational value from taking his course. And now that's not quite so true, because I teach laryngeal manipulation. I just teach it in a slower, more subtle version, one that patient has more input in. So, I think maybe we're kind of heading in the same path, trying to drop that, that purely biomechanical, anatomical, physiological approach. At least not, we can't totally drop it, but the incorporation of the individual we're working with, I think it's really, and I hate to sound extreme, but I think it's lost on a lot of people. We're the experts. We should know what to do. Patients feel we're the experts. They hand everything to us. But I think that leaves a lot to be desired when it comes to information on how to best connect with the N of one that's sitting right in front of us.
That was huge, really. On the first, I think I did the first level with you in Athens in May of 2023. And I had done some work I had done some of your work that was online and recorded, and that was my first introduction to the patient-centered approach. And I was like, oh man, yeah, that is key here. That is what is missing. That is what, because what has been endowed to us through previous work was exactly what you said before, that we are the center of knowledge. And so our intervention pivots around what we know. And even though I think I'm confident that a lot of therapists had an inherent sense that, you know what, maybe I should listen to what the patient is telling me, but not really knowing how to use that, how to work on that. And so when I was introduced to your work, I thought it struck a chord. I thought, oh, yes, of course, of course. Of course, I have to use what my client is telling me and ask him. But then it went deeper than that. And I think you touch upon that really deeply in your workshops. The cultural context of that. So I haven't worked in England for 25 years, so all I can speak of is the context in the Greek culture. It's very much that culture of you're the expert, you know, you tell me what to do. So getting people to suddenly feel empowered and having their own opinion and their own needs listened to is huge. And it takes a lot of work to set that up first before you actually get to doing things. So once I do manage to do that, I'll use a bit of both. So yes, I'll also use a little bit of Lieberman work, but through the context of Fritz. So I'm going to try doing this, but I need you to tell me what that feels like. I need you to tell me whether you need more or less of it, or I need you to tell me how else I could do that might better work for you. So I think combining that.
Yeah, but you're the expert. Shouldn't you know what to do to me? I'm role playing here with Elpida.
They do. They'll say
Yeah,
of course they'll say exactly what I said.
yeah,
In as much as I know what I want to do with you, I'm an expert. But in as much as you need, in as much as you know what you need to have done, you're the expert for yourself. So let's put our two bits of expertise together.
yeah,
And then maybe we can get to a better result. It's difficult. I haven't found it easy. The wording is particularly difficult, and the translation into Greek really doesn't work really well. So I think colleagues of mine were saying that in your advanced workshop. They're saying, God, how are we going to say that? And so some people had found this translation, other people had found different translations. It was very interesting to find how people would word it.
yeah. I know when I taught in Asia last fall, that was a real common theme that I heard that, you're asking me, a clinician, you're asking me to empower my patient, almost reset the boundaries in cultures where those boundaries are very, very clear and they're not straight on, away from. And, I live in the United States. I certainly travel around the world, but I can't know what it's like in every single culture. I know in my culture or the mixed cultures here, some people really, really just immediately light up when you give them choice. And others, they almost rebel against it. It's like, no, this is too foreign. You're supposed to take care of me, and I guess I'll go find somebody who will do that. So that is a hard part of my work. I think in some ways it's harder to incorporate shared decision making than it is then to do the actual therapy. Because the therapy is what they teach you in, a course in school or whatever. Here's how you apply it. But how do we mix that in? Almost like Leah Halou says in her papers, the metatherapy. Yeah. And I think that is the key, not just to my approach, but a lot of evolving approaches that are seeing the limitations in that, clinician as expert model.
Well, I think what I've found more recently that works for me is this. I say, so I have a little introduction, and my introduction is something along the lines of, look, science and medicine and the sciences that deal with motion and habit and emotion. A lot has been unveiled. We know a lot, but there's also, we now are very confident about how much we don't know.
Yeah.
So if we put all that together, something we know, and then something we don't know, and something you know, and something we're going to discover together. And if we all pack that in, then let's see where we can get.
Yeah.
And that seems to clarify issues.
That was really well put. Does that translate then well to the Greek
Yes.
culture? Does it?
Yes,
Good.
that
Good.
translates. And then because I think it sort of clicks and they think, oh yeah, you're right. Yeah, I know about that. I know about medicine, the medical world, and not knowing everything and not having answers to everything. So the
Right.
one thing is the shared decision making. So that was one hill to get over. And then the other hill has been, as per Lieberman, and not only Lieberman, but all the training that I've done side by side with our voice physiotherapists, along something along the lines of no pain, no gain.
Mm.
So the other hill to get over with clients is this fixation on, yeah, but okay, don't worry, I can take it. Just keep pulling or keep pressing or keep probing. And yeah, it's okay, I can take it. So
Yeah.
it's the I can take it motive. And there's the if it doesn't hurt, then it probably won't get well.
Yeah. It's funny because just before we came on today, I just recorded another video on, does stretching have to be aggressive to be helpful? And it was all prompted by, I just taught in London last week. And one of the clinicians, and I'm sorry, I can't quite reach the piece of paper, said something like, we need to make each other know that pulling another person's tongue doesn't have to be like taking the ticket at the meat counter. Now, I don't know if that is translatable into Greek, but here, you walk up, you grab a hold of that thing and you pull it right off. And I love that comment that this person left, that where did that come from? Where did that thought? And I don't think it's just voice coaches, voice teachers, or speech therapists, because I mean, no pain, no gain is it seems rather universal.
Yeah, and it's that, in my brain as well, find the trigger point and really
Yeah, dig at it.
and yeah, dig at it. And yeah, it's hard work. It's been hard work for me to get out of that mind frame, and I can understand why it's difficult for patients to get out of that mind
Yeah,
frame. But they get there. They get there
yeah,
real fast, and the results are evident.
yeah. I think I had to grow a lot too in saying, first of all, I was the expert. So I'm going to dictate what to do. And then I went over the other side. It's like, no, you're the expert. I'm going to let you tell me what to do. But shared decision making to me is about the two of us making informed decisions, setting our boundaries, having a clear goal in mind. And sometimes that does mean I need to possibly pull harder on someone, push harder on someone, poke harder on someone than me as a human being likes. But I want to meet your needs and values and preferences. So does this feel safe? Does this feel helpful? Does this feel useful? And it's really challenging. I think more challenging to seasoned clinicians, seasoned manual therapists who've been doing this work for so long. They're so they're so ingrained in, no, I know the exact amount of pressure that will take care of this. We don't. Someone
Well,
foolishly taught us that, but we don't.
I'll tell you what really took me over that hill was when in the last workshop, the advanced workshop, I was your patient. And it was impressive in my head, the functions that happened in my brain when you asked me something that we've been saying the whole workshop. I'd been translating for you, so I had translated it many times, but no one had asked me. So when you asked me, does that feel useful? It was like, whoa, it was huge. So I was like, oh, that's what happens to our clients when we ask them, does this feel useful? Does it feel safe? Do you want more? It's huge. The synaptic energy there is just massive.
Yeah, yeah. And yeah, and in your role, for those of you that don't know Elpida, you were not only taking the course, but you were my translator, translating everything I would say. So you were wearing a lot of hats, and all of a sudden for me to hit you with that question. And I remember that moment on our little stage there where you were like taken aback. It's like, boy, that's so it's such a unique question. Not, and again, we have to translate it, modify it, but does this feel useful to you as a human being? I
Yeah.
just I love the complexity, but yet the simplicity of that question.
Yes, yes. And it's deep and it's philosophical and it's emotional and spiritual. It's everything. There's everything in that question because it has so many layers.
Yeah,
And I find that it needs to be repeated or maybe rephrased sometimes as well so that
yeah,
people get it. What exactly are you asking me here?
Yeah. I used to get stuck in the one question. Is that feeling familiar? And it was vague. It is a vague question because a lot of people are like, well, I don't even know what familiar means. And how does that translate that into what we're doing? So I had to do over the past 5 years a lot of modification of my wording, not
Yes.
not these are the only words that I use, but have more options available because,
Yeah.
we gotta ring that doorbell in the brain of the unique individual in front of us. And that's not easy.
Yeah. I also found something new as of after May, so after your last workshop. I found myself feeling very relieved when I asked the question, does this feel safe?
Mm.
So when I was putting that, when I was putting that out there and listening for the feedback, when I got, yes, it does feel safe, wow, I felt such relief. I thought, phew, all right, good. Shall I keep going? Would you like me to do more of this or less? All this guidance really made me confident as a therapist
Yeah.
rather than hoping to guess that I'm doing the right job. So
Yeah.
lots of different levels to the questions.
Yeah. And I
The
think
is it
for
familiar still hasn't translated well to Greek. So
now,
we
and
still
you
don't
know
know
what?
what to
And
reword it.
I use it less and less myself. So, you know, I we have to come up with the words that work for us, right?
Mhm.
And it sometimes takes quite a while to really get something that resonates with the individual. Why are you asking me that? Well, if the more you help me, the better I think I have a chance of helping you. And there's
Mhm.
all sorts of these, I try to build incentive on why the patient could and should wish to participate. They still have the right, the ethical right to say, Walt, I want you to make the choices for me. And,
Mhm.
there I need to lean back on my decades of experience. And when clinicians come into a workshop like mine, and maybe you're slightly unique because you had taken Jacob Lieberman's class in the past, but a lot of times the speech therapists, speech pathologists, and others don't have a huge like experience in touch in manual therapy, and that's overwhelming to them. But what I think is pretty cool, and it's taken me a long time to realize this, that by using the metatherapy, using shared decision making, using you helping me to figure out does it feel useful, safe, all those things, you're actually making this easier on me, the clinician. So I don't have to be the one to invent everything, right?
Yeah.
There was a word that was coming up when I was doing a lot of writing a couple of years ago, and that was the concept of co-creation, right? We are the two of us are creating this unique intervention together. And I think that's something that we need to really celebrate, not just in the work that I'm teaching. And I really mean this from the bottom of my heart. I hope everybody just steals these concepts and it starts incorporating them in all the various kind of works that they use, not just manual therapy.
Absolutely. I was even thinking that. I mean, when we were doing voice clinic with my phoniatrist the other day, I was thinking, God, this really needs to slip in there. What about the doctor's language using that when they're putting someone on the scope? How's this feeling? What would you like me to do? Just even going to the dentist this needs to be incorporated there. Just this, like you said, the sharing
Yeah,
and
yeah,
just the empowerment that the patient feels that he's not just a guinea pig left to your expertise and
yeah, yeah,
inshallah how that's going to go.
yeah, exactly. Yeah.
Yeah.
Any like final words for maybe the new therapist or somebody who's thinking about this work?
I remember myself when I had first done the Lieberman course, I thought, God, it's really scary when you haven't used your hands because you're a voice therapist or a speech therapist. It's really scary to actually put hands on someone.
Mhm.
One of my advice, and I think this helped me, was just to. I'm a very touchy feely person anyway, and Greek society welcomes that, so we're allowed to touch each other as Greeks. But I think if you ask friends, just in a comfortable setting, can I just fiddle around just a little? Can I just put my hands on your throat just to feel what your larynx feels like, what your shoulders feel like, what the back of your neck feels like, just to get general population sense of touch on your hands, which might seem funny for a physio, but for a speech therapist, it's not. It's just peculiar to put your hands on people.
Yeah.
And then once you get that, maybe just then incorporating the shared decision making. So, how would you feel if I sort of poked you there?
Mhm.
And what happens? What do you feel when I poke you? What do you feel when I ask you about if I can poke you. And
Yeah.
just, I think if you could just play around with your friends for like a few minutes every now and again, just to get acquainted with the body in a different way,
Yeah.
that's a good start, I think.
Yeah. Yeah. I know that I, I I don't mean to make fun of, but a lot of times I'll see new therapists, new speech pathologists. They'll be doing something that I guess I sarcastically call the SLP dance, where they come in and they start fiddling like this. And I'll often, without being sarcastic, I'll ask, what is it you're seeking right there, right? What is this touch intending to help you find? And there's often a bit of a lack of an explanation. And maybe it's an initial way how someone was taught to touch. It's not wrong nor right. I'm always just sort of fascinated by that. You guys are trained different, and maybe you come, with a different AB type personality. Like, what does touch mean to you? Because in PT school, it was all about touch, at least back in the 80s, and certainly most of my career. But, the thing that I try to do is, and this, is the lingering touch, right? To give somebody time to feel safe, right? Before we start doing anything. And I think that that's what one type of intervention is not better than another, but I think they're different with the potential to reach people at different layers. And I thought that Jacob Lieberman's work was brilliant. It didn't jive well with my background, but I've really come to accept a lot of the principles. I just feel like we could take that really well-grounded work. It's been in the literature now for, gosh, 30 plus years on, helping with voice disorders, help with swallowing disorders, et cetera. And we can evolve that into something that's not so operator driven, but make it an interaction. And I think that's the thing that I'm trying to strive for. Allow our touch to be a form of communication with this person.
And also behind that, I mean, in terms of what would I like to tell younger speech therapists is something that I say in my workshops. So the workshops I teach, we end up doing a therapy plan for a few cases. And I think the critical question that I'd like speech therapists to always ask themselves is what you said before. Why are you doing this? So you
Mm,
want to do so and so, you want to put your hands on, or you want to do this technique, or you want to do the other technique. What is it that you're looking for? How is this? Why is this applicable to this particular person for this particular problem?
right.
And if you find this why and you unravel it, and we do it in a very structured way, then go ahead and do it. If there's an answer to your why, any answer, either your answer or their answer.
Right.
If there is an answer to the why, then go ahead and do it. Try it out.
Yeah.
Maybe it'll bring something valuable to the person.
Yeah. And I know that during our conversations, both during the class as well as, away from the translation piece of the class, I love the depth that you've gone to with a lot of the concepts that we're talking about here, the metatherapy, the language, the interaction, trying to figure out who this person is in front of you and how can you make that work resonate to them. So it's been really fun working with you in that way.
Yeah, thanks, Walt.
Yeah.
It really, yeah, well, your work has really struck a chord. It really resonates with the way I think
Yeah.
clinically.
Yeah. So give yourself a plug here. What are your courses?
My courses are, I've created an approach to voice therapy. It's called the integrated voice therapy approach, and it literally integrates work from a lot of people. So from at the Estel approach, the Lieberman approach, the Verdolini approach, the Voicecraft approach, and bringing that all together and really seeing voice through the prism of the mind, the body, and the emotion. So your body does something because your habitual brain tells it to do something. And that's dictated a lot by what's going on in your emotional world. So if that's what's happening for a healthy voice, then a voice that has gone wrong needs to work on all three levels.
Yeah,
So you need to think about the person's thoughts, his body, and his emotions. And that's how I train people to go into voice therapy.
that's
So
great.
it's
Yeah. And I'll put the link in the YouTube video link, the link to your website. So
thanks a lot.
hey, thanks so much for spending time with me today. I know it's a evening over there in Athens. So it's good to see you again.
Thank you. Thank you so much, Walt. It really was a
Thank
pleasure. Thank you so much.
Great. Thanks a lot.
Bye bye.